Swadikap, and good afternoon, all participants, those from here and also who participating remotely. My name is Dr. Jate Ratanachina from Chulalongkorn Medical School, and today we have a very good opportunity to have Dr. Dennis Carroll here, that he will give us exceptional, not just lecture, talk in the topic that is very interesting and also very important for us, global health diplomacy. So first thing first, may I introduce the speaker here today. Dr. Dennis Carroll, he currently serves as an advisory, serve as a School of Global Health as a scientific advisory, and he also appointed as a distinguished professor of the Faculty of Medicine, Chulalongkorn University. He also served as senior advisor on global health security at University Research Co., or URC, and also the chair of the leadership board for the Global Room Project. He has also served in the field of the research in the global health for more than 30 years across the world, especially in Africa and Asia. He also served as the director of the U.S. Agency for International Development's USAID Emerging Threats Division. So welcome to Thailand again, ครับอาจารย์ Dennis. So firstly, I would like to introduce the session today is about COVID-19 pandemic, that the lesson that we need to learn in the aspect of the global health diplomacy, that we have very good opportunity. So I shall pass the stage to Dr. Dennis.
First off, thank you for the introduction. More importantly, thank you for the invitation to have a chance to chat with you all. I'd like to, is this on? Can you hear me okay? Okay. I'd like to make this is a lunchtime talk. So let's think of it as food for thought, all right? And use the opportunity. I will talk about global health diplomacy. We'll talk a bit about what it is, but also the importance the COVID-19 pandemic has shown a light on how critical global health diplomacy is and needs to be, and how we need to get better at it if we are going to have a world that's safe and healthy. So again, I'd like to come back and emphasize this is a discussion. I have some slides here. If you have questions, feel free to interrupt, but most importantly, I'd like to leave a lot of time for discussions because I'm going to end with a question. And I'd like that question to provoke some thoughts from you, and everything is fair game. I mean, this is a space we're all struggling with. So every idea is in itself worthy of being discussed. So I would solicit your input into this and turn it into truly a nice lunchtime experience, okay? So today's talk is going to be about COVID-19 pandemic and global health diplomacy. Most importantly, it's about critical lessons we need to learn from the last 2.5 years. If we're going to live in a world where we never again have to deal with the threats of a COVID-19, what are we going to have to do differently? And more importantly, what is the role of global health diplomacy in contributing to that safer world? There are 4 lessons and 1 key action that I'd like to talk about. 4 lessons from COVID-19. And the first is that it's a very sobering thought, but COVID-19 is not a black swan event. And by that, I mean it's not a rare event. 100 years ago, that may have been a truly black swan event. We talk about these as a 1 in 100 year phenomenon. And 100 years ago, that very well may have been the case. But there's a fundamental reason why today is different than 100 years ago. And that's because 100 years ago, there were 1.8 billion people on this planet, impacting on this planet as they did. Today, within 100 years, we've added another 6 billion people. And by the end of this century, we'll add another 3 to 4 billion. And that dramatic expansion in our presence on this planet has really had a disruptive effect. Unintended, but by and large, significant. Our interactions with the ecosystem have dramatically changed the kind of equilibriums which had been in play for a millennium. And we see that with new diseases. They're happening with greater frequency because the greatest single driver of new diseases is human population pressures and our expansive interaction with the ecosystem around us. We've changed the equilibrium so that viruses which are circulating in wildlife, and they've been circulating there for hundreds, if not thousands of years, are having a greater opportunity to spill over into us because we're incursion into the wildlife spaces. And that is why COVID-19 is no longer a black swan event. These are happening with greater frequency and because of global travel and urbanization with greater intensity. So we shouldn't take solace. Maybe at some point COVID-19 will end, but the fact is it's not the first and it will not be the last of these threats. So we need to be asking ourselves, what can we do now to make sure we never have a COVID-19 threat? The second is, in years past, when these events emerged, by and large, we could take some kind of solace that the populations that they were impacting were so far away and global travel was so restricted that local events largely stayed local or maybe regional. Every once in a while they became global, but rarely. That is a different world we live in now. The population dynamics, the transportation dynamics, the movement of populations is profoundly different today than any other time. And we need to take to heart that a threat anywhere is a threat everywhere, not just for pandemics. We saw with the West Africa Ebola epidemic, a virus that has no pandemic potential. That is, left to its own, it could not spread around the world, unlike a respiratory virus, which can spread rapidly around the world. But we saw that a very poorly transmitted virus like Ebola could end up getting on an airplane and traveling anywhere in the world. So we need to understand that a threat anywhere on this planet today is a threat everywhere, which means that we can't look at local, this is the third lesson, we can't look at these local events that may occur as something that we have no responsibility for. We need to recognize that these threats are in fact global threats, no matter where they occur and how they occur. And as such, as global threats, we need to have well-coordinated global action in order to minimize their impact. It's not every country acting on its own. And lastly, the COVID-19 global response has been a failure. That's the last lesson we really need to take home and be very sober about. And it's largely because we did not take the third lesson into account. That is, we did not offer a coordinated global response. One of the real hallmarks of this whole pandemic has been the fragmentation and the collapse of what had been longstanding global partnerships and networks. And we found, even in regions where there were strong political and economic unions, really anarchy in terms of the response. Europe, you had border closures from one state to another without any discussion. You had the competitive spirit of trying to buy rare, very highly sought after protective equipment. Everyone from Europe and the United States, it was a free-for-all. And ultimately, we see that playing itself even out today in terms of vaccines. The inequitable distribution and availability of vaccines still is not targeting our valuable resources where they're needed, making sure that the health workers that are most vulnerable in the world have access to it. Same way we don't drive our vaccines to follow where the greatest risk populations. In my own country, we have put priority over vaccinating 18 and 25-year-olds over vaccinating 60 and older people in Asia or in Africa or in the Americas. And from a public health epidemiologic perspective, that's just fundamentally wrong. And ultimately, in terms of the impact of this virus, it only perpetuates and enables this virus to circulate in ways that further enable new variants to emerge, which means that even the technologies or tools that we develop to counter this measure are quickly being stretched and becoming less effective because we're allowing this virus to circulate uncontrolled, particularly among the high-risk populations. So these are lessons that we not only need to be aware of, we need to ask ourselves, what can we do, mindful of these lessons, to really build a future that is safer, not just for the few, but for everyone. Again, we live in a global community in a way that's unprecedented, and there's no safety by way of distance on this planet anymore. Ultimately, the action that comes out of this whole exercise is that if these are events that are going to happen with greater frequency, that they are inevitably going to pose a global threat. And that's not just pandemics, we're talking about epidemics as well. And we need to be careful about this, that the disruptive effect on the economy and the social well-being of Ebola in West Africa on the United States was significant, certainly in Europe, where there were exported cases. So it's not just about pandemics. That's sort of like what everyone's talking about today, but pandemics and epidemics now constitute global threats. And so if we take that to heart, then we need to say, what are the things that we can do as a global community to reinvigorate and build new partnerships and alliances that not only bring into play the kind of preventive measures that could really address the emergence of future diseases, but also make sure that we have the networks and the systems and the capabilities to, in a high impact way, mobilize the resources to really stop the spread of these viruses and really mitigate the worst of their consequences. That will require global action. So in this case, we need at its heart a much more robust approach towards global health diplomacy. So let's talk about what that is. And you really have three levels of health diplomacy. There's the core or the global element, which is it's the interactions and negotiations among governments and states. And it's really bringing the diplomatic community, even as an arm of that diplomatic community, the development community, to think about the rules and regulations, the treaties, the actions that can be taken. On the one hand, to mitigate the risks of new threats, but also to invest and ensure the equitable access to key interventions that would be needed to disrupt the impact of such a new threat. So it's about what does it take at the diplomatic level to formulate those treaties, formulate those policies, formulate those regulations that become the backbone of any future response to these threats. But the next layer is it's the multi-stakeholder, where you're talking about the regional and sub-regional and sub-national level partners, thinking about ultimately the players that need to be brought around the table, inclusive of private sector, civil society, community groups. Ultimately, it's about making sure that you have not just the highest level policies and regulations in place, but you build the capability for the implementation and the oversight of those, and that they are permeating through all of the different sectors and all of the different communities that need to be in play. That also is a dimension of health diplomacy. And then lastly, it's making sure that the resources that are being invested in the research, in the development of new technologies, of the research that gives us better insight into the epidemiology and the clinical challenges that these different threats might pose, that we have health diplomacy that ultimately brings standardization across all of those spaces. And we saw sort of a remarkable spontaneous, if you will, health diplomacy in play that didn't involve diplomats per se. It was really driven by the scientific community, and that was in the vaccine development. For as much the diplomatic community was in disarray around how do you respond to this pandemic, the scientific community really stepped forward. And it was really remarkable how rapidly information about the virus became available, from the genetic coding level all the way to the epidemiology and the clinical, that allowed the scientific community in an unprecedented way to begin arcing out new technologies to respond, diagnostics, vaccines, therapeutics, that within 12 months were available. That's just utterly remarkable. Not just available, but with such remarkable efficacy. No one dreamed we would be having vaccines that would be 95% effective in preventing infection against the first iteration of this virus. It did have that effect. It was essentially a transmission blocking vaccine. But then we got Delta and we got Omicron, and this virus knows how better to avoid the constraints of the vaccine. But the vaccine still is preventing serious illness and is preventing hospitalization. That was really a consequence of the scientific community showing how they could exercise health diplomacy, how they could build the partnerships, the information sharing, the networking, and really bring the world the technologies that were desperately needed. The ability to use that technologies well was a failure, however, on the part of the diplomatic arena. So we have sort of a complex array of players and partners that are part of global health diplomacy, from the diplomats all the way down to the community level and the private sector and the scientists. So it's about making sure we've aligned our priorities, we've built the systems, we've invested in the networks that will put in play the kind of ability to deploy rapid and effective actions everywhere at the same time. And the players that are involved in this, again, represent an enormous array. And again, think about this in terms of the players at the global level, at the regional level, the national and the subnational level. But you clearly have, for things like pandemic preparedness and epidemic preparedness, WHO is center stage. And with that, other UN partners, FAO, again, if we're not just talking about responding to future pandemics, we're also talking about preventing future pandemics, then those entities that not only tell us about the challenges within human health, but also allow us to think about where the viruses are before they come to us and build the partnerships that allow us to go to the virus in their natural ecologic habitats, and use those partnerships to disrupt and prevent future spillovers. All of that is doable and possible if we have the right networks and the right alliances. Ultimately, you have a network of funders such as the World Bank, IMF, who provide international resources. You have bilateral partners such as USAID or the UK's DFID or Japan's JICA. You know, they play instrumental roles in providing funding both to these international organizations, but all regional and national groups. You have capacity and regulatory supports, as illustrated by the various Centers for Disease Controls and Prevention around the world, beginning to establish surveillance protocols, really being able to arc out epidemiologic profiles of populations. So you can begin differentiating high-risk groups when we begin to face new challenges. And obviously, we've seen with COVID-19, our understanding of high-risk groups very rapidly began to allow us to think strategically about what does it take to protect those high-risk groups but we didn't necessarily use that knowledge, as I mentioned earlier. Our deployment of vaccines against very low risk versus high risk populations was skewed by political dynamics that made these interventions really less equitably available. You also go back to the issues around research. The research community, both in terms of their information sharing and sort of investment in innovative technologies or approaches towards dealing with these things, the emergence of mRNA vaccines, long invested in as a way of trying to deal with cancers and other diseases or conditions, suddenly being able to pivot to tackle the newest threat and its remarkable consequences of that. So you have the research community is clearly a key part of the global health diplomacy arena. And then you have independent foundations we know, such as the Rockefeller and the Gates and other foundations, are critical in terms of augmenting additional resources or being able to invest in those marginal things that could, in the long term, prove to be transformative. And the ability of foundations to do that. And then you have development agencies whose really its primary responsibility is to partner with governments around the world to invest in their long-term capacities, their long-term systems, for them to be able to really take on the normative challenges of their own population and not dependent on external capabilities. So all of these come together in a complex dance, if you will, around global health security. It however, raises enormous challenges. Even as we talk about the global health systems, which is hard to see on this screen, but again, that arcs out pretty much what I just talked about. Who are the players? Who are the partners that are at the center stage of global health security? Well, when you're talking about then the areas that you have to address, if you're really being forward-leaning, it's not just about the issues that we would typically think of in terms of health, which is clinical management and the health systems required. You've got trade and investment. We've seen the proliferation of and the movement of dangerous viruses associated with trade. Avian influenza is a perfect example that the biggest driver of the H5N1 virus out of Asia in 2005 was the trade of poultry, and particularly day-old chicks. And so those viruses ended up sweeping into North Africa, into Africa, all the way into Eurasia as well. So global health policy needs to deal with how do you better manage the way we trade. Agriculture, the whole issue of the role particularly of livestock, and they're acting as an intermediary host for further amplification and spread of new dangerous viruses. What are the global health diplomacy issues that need to be embedded in there? And how can you use sort of a coming together of agriculture and trade as a way of thinking how you incentivize better biosecurity and better management of animal health to lower the risk of potential exposure and infection? And can you incentivize trade benefits to those countries that bring stronger biosecurity and regulatory measures into how the interactive interfacing of animals, wildlife, and livestock and people are? So if you are able to incentivize that all through global health diplomacy. Issue about mitigation. Again, some of these issues have to do with how the disruptive impact of how we are building roads into wildlife preserves to access not critical minerals for our economies. Everyone in this room that has an iPhone or any of these technologies or this computer here, they're being driven and run by rare minerals that come out of wildlife preserves that we're building roads and putting populations into that are further exacerbating the opportunity for wildlife and humans to interact and allow those spillover events to occur. So if you want to mitigate these issues, you're going to have to think strategically about where those risks of spillover are most likely to occur. They're not equal around the world. They're really aligned with certain hotspots where people and animals in the ecosystem, their convergence is combustible. And so how can we use policies that can allow us to mitigate? There's no reason why a spillover from a wild animal into human should ever occur. It's how we're in the wild animal's doing nothing. It's what we're doing. And we're creating opportunities. So policies, again, are central to that. Education. How do we make sure the next generation of leaders are getting the kind of education that helps them understand these issues, the complex dynamics between our footprint and our disruptive effect on the ecosystem? All of this is unintentional. How can we bring better education into the equation that allows people to make investments that are smarter, safer, and less disruptive on the ecosystem? And we can learn to live in closer harmony. We can take a planetary approach, but education is going to be critical to ensuring that next generation of leaders, whether they're in the medical field or the veterinary field, the ecologic field, the financing field, it doesn't matter. How can they be much better attuned to understanding how we can invest and build the kind of society that lowers the risk of these events? They're not inevitable. And then, as we know, environment. Again, there's massive investments that need to be made. And this is a case where we need to also recognize that many of the threats that we're talking about, the underlying drivers that potentiate new emerging diseases, they're convergent with the same drivers that are giving us climate change. And so how can we, through, again, global health diplomacy, build the kind of policies and treaties that not only address the threats caused by new emergent diseases, but don't deal with these issues in silos, recognize that there is a convergence of risk and threat and impact from global health, both in terms of infectious diseases and climate change. And how do we build, again, through the kind of interactive dynamics that go on in global health diplomacy, the ability to deal with those issues, and ultimately security. As we've seen with COVID-19, it is a tremendously disruptive impact on social, political, and economic norms. And it stretches the security environment that we live in. So political security becomes very unstable. And we've seen just how, just within my own country, how politically unstable we've become, in many regards, sort of further amplified by COVID-19 and the stresses of isolation, the stresses of quarantine, of behavior patterns that people are resistant to. So all of these issues, they're really the challenges for global health, and they're challenges that the global health diplomacy needs to take on. So if we're trying to think about a way forward, and if we're trying to think about what are the policies, the practices, the investments, the actions that need to occur in the years to come, here's food for thought. Just think about it for a moment. Part of what we've learned under COVID-19 is the inability of our systems to be resilient in the midst of a crisis. How do we build more resilient systems? And not just within countries, but within regions, cross borders around the world. So part of the deal that we have to make as we think about future diplomacy and partnerships and networking, a core of that is investing in resilience. The other is the supply of medical countermeasures that are both biomedical and non-biomedical. PPE was a critical issue early on. Masks was a critical issue early on. So we have challenges around global health diplomacy to make sure that we don't foster the kind of chaotic, the richest get in the front of the line and are able to procure these things at the expense of those that are probably at the greatest risk. So we need to think about that. Global governance. Nothing is more true than over the last 6 years. The rise in populism and nationalism has fragmented longstanding and undermined longstanding regional and global networks. How do we revisit the issue of global partnerships, global governance, begin to move away from the primacy of nationalism, and make sure we've got a kind of governance system for these global health diplomacy activities that give accountability, that provide transparency, and ultimately provide ownership to those that own it, which is all the way down the system into the community level. So what's the kind of global governance system that will enable, but ultimately be held accountable for being able to be responsive? And then the issue about empowering surveillance and research. How do we make sure we have systems and networks and partnerships that allow us to really maximize the capabilities of our surveillance systems, not just for looking for new outbreaks, the event, but being able to have surveillance systems that move us further upstream to where the virus is still circulating in its natural habitat, that we have surveillance capabilities that are capable of tracking and monitoring risk and the evolution of risk, not just the outbreak, but the pre-outbreak risk evaluation. And then the research that allows us to think about new countermeasures. You know, what's the role of new scientific breakthroughs like CRISPR-Cas? Does that portend new kind of biomedical countermeasures that may make vaccines very much a 19th century technology, which is very much what it is. So these are the instruments. So how do we develop then? And the outer ring provides us with some of the details of what global health security is going to, or global health diplomacy is going to have to do with. You know, the issue of a global health threats fund. You know, we've shown that we can do this before. And 20 years ago, there was a global health fund established for HIV, AIDS, and malaria. It didn't exist prior to 1999. But the AIDS, you know, the global fund became a backbone for being able for countries to access resources to deal with these three issues. How do we build a similar fund that will enable the investments in the systems and the capacities to deal with both that upstream pre-event surveillance and monitoring, as well as dealing with the systems to disrupt opportunities for spillover and the systems to ensure we have adequate health care. Most importantly, health care for populations that prior to a pandemic can have equitable access so that they are less likely to be living with pre-existing conditions. We've seen that the populations in my own country, not surprisingly, that are most burdened with pre-existing conditions are the very population that have the least access to health care at the clinical level. They get no access to preventive health care. So again, the global health diplomacy space is going to have to deal with these issues. And that, and you can look around this, and I leave this for you to look at more carefully, but you can look that there are spaces that we have. Global health diplomacy is going to have a clearly articulated playbook with clearly articulated goals. This diagram here provides some goals and some targets, but over time those evolve. How do you build the partnerships for global health diplomacy to focus on these endpoints? These are the things that they need to focus on. And if we focus on these, we'll put ourselves in a far better position to not only be able to respond more effectively to the inevitable future threat, whether it's an epidemic or a pandemic, but also really elevate our ability to prevent that event from ever happening. But it's going to require that as a community, we come together, we build the partnerships, we build the investments, and we build ultimately the long-term shared vision for how, as a global community, we can respond to a threat anywhere, because we fundamentally understand that threat is one that we're all ultimately faced with. So global health diplomacy is about really embracing the notion that a threat anywhere is a threat everywhere. And as such, a threat anywhere requires a global response. And you don't want to activate a global response in the face of a threat. You want to activate the systems and capabilities of a global partnership before the event to deal with prevention and response. So these are the kinds of opportunities we have with global health diplomacy. Ultimately, and this is the discussion I would enjoy having with you. So how do we do it? We've not done it well yet. So it's not a matter of just repeating what we did. You know, Albert Einstein famously said, if you keep doing the same thing over and over again and expect a different result, that's a definition of madness. We can't approach global health diplomacy by just rebooting what we've been doing over the last 20 years. We need to rethink everything. So, and you're part of the rethink. You know, this is ultimately the world that we're talking about over the next 20, 30 years. That's your world. That's the world you're going to be responsible for. What are the things we need to do in order to be successful? So I'll leave it at that, but I would really encourage you to offer your thoughts. I'd really welcome. Food for thought. It's a lunchtime talk.
So thank you, Dennis, for great talk and also pretty interesting. As the session today is interactive and very informal, I would like to invite you all, those who here and also by Zoom, who participating remotely, to have any question, any issue to be discussed with the true expert in the field.
That's right.
All also welcome.
Questions or observations or comments, or to take issue with anything I've said.
So I think there's also someone also typing, but may I ask you first?
You may ask, yes.
As we are in the medical school, and one of our strategy is just to produce human resources to not only for serving in the field of health or public health, but also as you also mentioned a bit about global citizen, we also have some mission to serve people to the global community. And we also see that some also expect that the COVID-19 should be ended perhaps maybe the end of this year or later. My first question is, what is the opportunity after the end of the pandemic, hopefully, particularly in the level, the aspect of low and middle income country like Thailand, and also how we could prepare human resources for the coming opportunity.
Let me first off caution all of us to say that there'll be an end to this pandemic. Look, we've been down this road before. We've declared victory a couple of times along the way. The one thing that has been the most predictable about this pandemic is its unpredictability. And the second is the constant evolution of this virus. We're dealing with a subvariant now of Omicron. A year ago, a year ago, we would have been talking about the Delta variant and the various challenges around the Delta variant. And we thought we were beginning, particularly with vaccination, beginning to put the pandemic behind us because the Delta variant was much more susceptible, and because it had was a modestly infectious respiratory virus, the potential of reining this in seemed quite high. And then Omicron came along, far more transmissible. And then we have, BA2, BA2.1, BA2.2.1. We're finding new iterations that are constantly becoming more efficient. I say that we have to be cautious about saying this pandemic will end because there's nothing to suggest two things. There's nothing to suggest that this virus is going to disappear. There's nothing to suggest it will attenuate itself. What we've seen is a remarkably robust virus that knows no seasonal limits. we thought early on as a respiratory virus, it would behave in ways that were similar to an influenza virus. So that first summer of 2020, everyone was holding their fingers crossed that it would behave like an influenza. You didn't really know that it would give us 4 months of breathing room. Well, we got another huge spike in the middle of summer, not the least of which in India when they were having temperatures of 110 degrees. Delta was spreading like crazy. So we have a virus that presents itself in ways which are extraordinarily unique. And talk as a clinician that we now have, I was reading an article today that up to 1/3 of mild to asymptomatic infections are now associated with long COVID, which means you're dealing with potentially a chronic condition that is going to be weighing on society for a very large population of people. And that's with the current virus. And we know that in 6 months from now, the current virus will be the old virus and there'll be a new virus. What will its dynamics look like? What will its impact? So I just think in some way we have to, it isn't about the pandemic ending. It's about how do we adapt ourselves to live with this virus, but it's fundamentally forcing us to change our behaviors. We're not going to live the same before. It's sort of like populations that were vulnerable to HIV live a very different lifestyle today than they did prior to HIV. And the AIDS pandemic is still here. And if people begin acting in ways that enable that virus to transmit, it'll reassert itself very quickly. And in some way, we've learned to live with a pandemic in terms of HIV, but that impacted on a relatively narrow population or populations within this world. This virus is potentially, everyone is fair game. So I just want to, the cautionary note, we all want this to be behind us, but it's only going to get behind us when this virus, when something happens to this virus, when ultimately the dominant strain is equivalent to a cold or something like that. But even at that, it'll continue to mutate, so you don't know whether it will not attenuate itself. It could become more lethal. It could become more efficient in its transmission and even more deadly. That said, to go back to your question, look, I think I really like looking at how scientists responded to this particular pandemic and how they spontaneously opened up a cross global dialogue and partnership. Yes, there's always competitiveness and there's always, jockeying within the scientific community. But the end result was within 12 months, we had multiple vaccines. We have at least one really, really good antiviral treatment, one modestly good antiviral treatment. We're still plagued with really, I think, really lousy diagnostics. But that said, if we had a serious investment in the next generation of diagnostics, that's ultimately, we're going to need that to know where the virus is and what its current play is and how it's rapidly evolving. But I think the scientific community has provided us with some real insight as to how we, look at the data portal where virtually all of the richest data portal on the coronavirus as in terms of its genetic construct. It's an entity that sits outside all governments. GSAT, it was originally established as a data portal for influenzas to deal with some very fractious political issues around avian influenza, to give a safe platform for researchers and surveillance people to put their data. It quickly pivoted to become the go-to place for all coronavirus data in the world. And that, again, you can look at the architecture of GSAT and see how it enabled, inspired, and built trust within um, the communities to continue to deliver that information. So I think the scientific community did a great job. The politicals need to sit in a room with scientists, and those scientists are bad articulators, so they can never explain what they did and why they did it. But
Thank you for important message about
Yeah.
firstly about the end of pandemic, that we need to realize about this term very carefully, and also challenges as you mentioned. And I also have another question from remote from the participant who join us remotely. This might be a bit similar to the last sentence that you mentioned. How could we take balance between the effective diplomacy, I think it also politics, and also global health actions on controlling the COVID-19? A balance between
the first part again, could you repeat that?
the effective diplomacy, I think also including political issue, and also actions on global health, public health,
Yeah.
on controlling the COVID-19 pandemic.
Well, first off, effective diplomacy, effective diplomacy needs to make sure that what they are talking about, what they're focusing on, is consistent with effective science, right? And so we've seen lots of examples of what diplomacy was focusing on, aspects of this pandemic which were not consistent with what science was talking about. So I think first off, we need to make sure that global health diplomacy is well informed and well guided, and that the targets and the goals of health diplomacy are really consistent with achieving the endpoints of global health. So I think that's one thing, which puts a real burden on the health community to be very clear on what it is that they're saying needs to be done. And we were talking earlier, one of the real problems we've had in this pandemic is that the health community has many times, it's been like the Tower of Babel. They've been speaking very contradictory, giving very contradictory messages. And not only has it confused people, but it's also empowered segments of the community who want to undermine the whole response to COVID-19. So I think not only does the diplomacy needs to make sure it's targeting the right goals and targets, but that the health community really does a much better job in communicating what those targets, what those are. And I'll just give you one example, again, within the United States, but I think this also happened in Europe. There was real confusion early in the pandemic as to whether or not masks were helpful or healthy or useful or impactful. And so our senior most health advisor, Tony Fauci, in March of 2020, sort of dismissed the use of masks. And that set a stage a month later when everyone pivoted back, yes, we need masks. Well, you had said a month ago, and then there's some really tough explaining. What they were really trying to do the month earlier was reduce the demand on N95s and surgical masks so health workers would get priority access. But they didn't say that. What they said is masks aren't any good, and so there wouldn't be a run on the supplies and undermine health workers. So the health community there then set and stage to this day, a internet debate about whether or not masks are of value or not. And it's just undermined certainly the single most effective transmission blocking tool we have, which is the mask. The vaccines don't do transmission blocking. This is our best transmission blocking tool, but we gave really bad advice. So, the issue is that the health community needs to be more articulate clear, consistent on what the end game is, and the health diplomacy community needs to make sure that their targets perfectly aligned then. So there's two responsibilities, both of which did not a very good job and continue not to do a very good job today.
It should be one last
Okay.
quick question, please. Yes,
And if you
yes,
could,
please. Yes, please. Yes,
for
please.
my own benefit, if you could introduce yourself. You all know who I am. Yeah, I'm Dennis.
Oh.
So my name is Julia. I am from the US.
Sorry. Could you say it again? Yes. Fine.
Okay, yeah, this one's working. So my name is Julia, and I was just gonna say, kind of going off what you were saying about the masks, the vaccines, I know in some countries like the US have been faced with extreme opposition among some populations of people. And I'm curious kind of to know your thoughts on, I guess, moving forward, how to unify the people and kind of depoliticize science in a way, and kind of how that would play into what you were saying about global diplomacy.
Yeah. Well, again, it's really hard to predict the future. So part of what we're grappling with when we talk about the vaccines and vaccine diplomacy, what we're seeing is as the impact of the virus appears to be more mild now than even the earlier iteration, you see a real walking away from people getting vaccinations everywhere. And so the demand for vaccine is falling. And I suspect that will stay the case until you see if there's any change in the severity of the virus itself. So I think what we probably have to do is be much more targeted for who we're saying needs to get vaccinated. That we really need to, as a global community, pay attention really to three groups. Health workers, you need, no matter what, they need to be protected against a surge of cases. You need to make sure that high-risk elderly and people with pre-existing conditions. And I suspect over time, if this virus doesn't become more virulent, then those are the people that are going to be most vulnerable. 1 million people have died of COVID-19 in the United States. 75% of those are over 65. Right. Ultimately, we live with influenza in the United States. Typically 50,000 people die every year from influenza, and principally the elderly, sometimes 100,000. But we absorb that, we live with that loss. And I suspect that the COVID-19, if it continues to trend the way it is, more infectious but less lethal, then the real goal will be to manage the annual mortality in a way that allows us to keep going forward. So, if we can get annual mortality, say in the US, down to 50, 100,000, then I suspect people will just live with it the same way. It's just part of our landscape. And elsewhere in the world, I think, so these resources that we do have, we're now in we're not in the acute phase, we're in the chronic phase now. And it may be that we can free up these vaccines to be used more strategically around the world and use less of them to deal with people that are very low risk. That said, there's still this dilemma with long COVID and what the long-term implications of that is. So, it may be that the antivirals will allow us, as they become more commonly available, to also live with this. So I think that's, I think it's not about blanket vaccinating people as we go. It's not about blanket vaccinating people as we go forward. It is about being more strategic. But quite frankly, it was about being more strategic a year ago too. So.
The next question from medical student.
Hello, I'm Suvinay. I'm a fifth-year medical student. I have a question. I'm curious, what is your thought on the colonization of global health, and how does it affect the failure that we are dealing with the current COVID-19 pandemic? And what would be your suggestion to overcome these challenges in the next pandemic? Thank you. What is your thought on the colonization of global health, and how does it affect on the failure of our way of dealing with the current pandemic, and how should we overcome this challenge in the next pandemic?
I'm still not, maybe I'm not hearing the question quite right. So.
All right. So let me repeat again, okay?
Yeah.
So I'm curious on what is your thought on the colonization of global health, and how would this affect our way that we are dealing with the current COVID-19 pandemic? Does it affect our failure in dealing with the pandemic in the beginning? And what would be your suggestion to overcome this challenge when it comes to the next pandemic?
I think it's so similar to what you mentioned before. Like, what if it's happened again? What we can learn to deal with the threat?
Yeah. I mean, the reality is it's going to happen again, but the important thing is that what happens next may not look anything like COVID-19. We've learned over the last 3 decades that the microbial threats, and it's not just viruses we see with antibiotic resistance, similar threats of a global pandemic, if you will, of failure to be able to treat what are treatable diseases today. I think first and foremost, as we think about tomorrow and future threats, we need to really take advantage of understanding the diversity around which these threats may play themselves out. And by this, I mean, today we're focused on COVID-19, a respiratory disease. A few years ago, everyone was concerned about Zika, a vector-borne disease, completely different transmission, completely different. And prior to that, Ebola. Again, the transmission route is fundamentally different. The responses are very different. Avian influenza, again, a completely different transmission route. So I think first and foremost, when we think about what we have to deal with in the future, the saying is don't fight yesterday's war. Don't think about the future as if it's COVID-19. It may be a COVID-19. It may be a MERS. It may be a SARS. But it may also be, a incredibly lethal and very resistant bacteria that is able to move around the world. So we need, Sung Chi, the Chinese diplomat, scientist, warrior, 2,500 years ago, fundamentally said, if you know your enemy, you'll be victorious in every battle. If you do not know your enemy, you will lose. In this case, our enemy comes in lots of different flavors and varieties, and we need to be prepared for whatever that is. That enemy at the moment, we need to understand in terms of its own threat, its own nature, not necessarily what we just dealt with. And that's the biggest challenge we have. And I'll give you an example. We had the West Africa Ebola epidemic. And when that came to a close, shortly after that, there was a bubonic plague outbreak in Madagascar. And so we all rushed to Madagascar, and everyone started treating the bubonic plague as if it were Ebola. They were responding to it and had the same organizational and operational strategies as if it was Ebola, but it was a completely different disease. Its transmission dynamics were completely different. And, the first 2 months, everyone was just carrying on as if it were Ebola, and they were failing miserably. Ultimately, you had to take a step back, appreciate the bacterium on its own terms, and then respond, and the response was effective. So I think, if you're asking, the question about how can we better prepare for the future, well, the first part of preparing for the future is understanding that the future can come in a variety of different ways. And we have to have if you will, a playbook for each and every one of those. So the smart thing to do is to make a list of all of the different, what we know as transmission routes and transmission dynamics and impact, mild, severe. Develop a table like that for every possible way a future threat could potentially emerge and spread. And then ask yourself, what are the appropriate countermeasures for this particular problem? It may be very different than the other particular problem that you're looking at. So you have to customize your preparedness to be responsive to the very nature of the threat. Know your enemy. So we need to have a playbook that we can open up and say, disease Y, we're now dealing with this. We know the first characteristic is characterize that disease, understand it, and then say, okay, we've already understood that it transmits this way, has this sort of dynamic attached to it. These are the countermeasures, these are the things we do. And we haven't done a good job in sort of arcing out a multi-threat playbook like that so that we can address any future threat based on its terms, not the way we imagine it, but just the very nature, the epidemiologic and clinical properties that it has. Does that answer your question? I'm not sure if it does.
Yes.
Yeah, okay. So know your enemy, right? But I'd like to add, when I say that, I want to add one strong caveat. 30 years ago, 40 years ago, when we talked about bacteria, we only knew them in terms of the negative impact they have on our body. And so we developed whole clinical practices that favored the use of broad spectrum antibiotics to just wipe out that particular bacterium. Well, we subsequently learned that in the process of wiping out the entirety of the bacteria, particularly in our intestinal gut, there were long-term consequences. There were, in fact, good bacteria that were critical to our own health. I offer a cautionary note that right now viruses are our enemy, right? But it may be that we've evolved a complex relationship with viruses, that there may be whole families or sub-families of viruses that already we coexist. We just haven't identified them. And they're a critical part of our own well-being as well. So I think there's a body of research that we need to do to disaggregate whether there are gradations of relationships that we have with viruses. Some may be very bad, some may be actually codependent, and others may be, and I suspect the vast majority of them, totally inconsequential. So that's a side note.
Thank you, Dr. Dennis Carroll, for joining us today as the first ever School of Global Health lecture series. And we also hope to have another opportunity to invite you to be here again and give some interesting talk and important issues.
But I will also be talking Thursday.
Yeah.
Right.
So let me also introduce another session that Dr. Dennis Carroll will also give us another talk on this Thursday as well. You can also follow on the Faculty of Medicine, Chulalongkorn University Facebook and all the social media. And also another interesting session is also a workshop on Thursday. And for all participants, please also follow another opportunity to join School of Global Health lecture series in the near future, and please keep your eye on it. And I, Dr. Jate, Ratanachina, and Dr. Ms. Carroll, like to thank all participants today, and also enjoy your afternoon. Thank you. ขอบคุณครับ
And thank you for your questions. Sure.